So how prepared are doctors now to cope with treating swine flu, and what should people be looking out for? Here's Charlotte to tell you.
Well, if we take a look at how the virus spreads, first, it gets around in the same way as ordinary flu, so mainly through coughing and sneezing. And the symptoms connected with swine flu, they're also similar to those you'd get with seasonal flu, so they include fever, aching joints, headache, fatigue and vomiting. Now, doctors say good hygiene, that's the key to reducing the spread of this disease, and that means covering your mouth when you're coughing or sneezing, or getting rid of those dirty tissues properly. People who feel unwell up to 7 days after returning from an area, they're being advised to phone their GP or phone NHS direct. And health officials stress that there have so far been no deaths from swine flu outside Mexico, so it is not a pandemic yet. And they also stress that the virus isn't transmitted through food, so eating properly handled and cooked pork and pork products is safe.
Now, that's very interesting. I'm having my own private consultation with a GP here on the couch because this is Dr. Gemma Newman. What would you like to comment on what you saw there?
Well, it's very interesting. Obviously, the situation is always evolving, and we've actually been very well informed thus far as London GPs, certainly.
Yeah, well, you saw that headline in the front page of The Guardian where they have a story with one doctor saying, we don't know what's going on here. We had a GP an hour ago who refuted that. You feel you're being well informed by the Department of Health?
Yes, absolutely. I mean, currently we have received emails telling us about current updates, what we should and shouldn't be doing, what we should and shouldn't be advising patients. And obviously the situation, as I said before, is highly fluid. We don't exactly know what's going to happen. So it's just about knowing the situation as it is now and being able to advise people as best we can.
Right. What are you looking for, and what should people be worried about? What are the factors involved here?
Well, firstly, I'd really like to reassure everybody that the swine flu is very highly unlikely in terms of getting it. Only if you've been to Mexico or sort of a country that has a proven transmission should you be particularly concerned. And in that scenario, only if you're having symptoms. Those kind of symptoms would be things like a very high fever, muscle aches, a cough, a sore throat, perhaps diarrhea or vomiting. Those are the kinds of symptoms that you would be looking for. But
they wouldn't necessarily be swine flu, they could just be flu.
Exactly,
yeah.
That's the very important point. In fact, swine flu is very, very unlikely at this stage, very unlikely.
Okay, well if in the unlikely event you do contract it, how likely are you to die from it?
Again, very unlikely. As you can see from news reports, the only fatalities thus far have been in Mexico for whatever reason, and the people that have been diagnosed in this country, in the UK, have had mild symptoms.
Gemma, how can we protect ourselves?
I think the best advice really is to stay alert, as I've already said. If you are suffering from any symptoms, contact your own GP immediately. It's best to stay at home just in case, because of the small risk that you may have swine flu. It's important not to spread it. And either that or you could ring NHS direct. Other things that you could do, obviously general health advice, things like covering your face, particularly your nose and mouth when you're sneezing, regular hand washing, wiping of surfaces if you're using them regularly, things like that.
Because this virus can live for hours outside the body on various surfaces. So door handles, worktops, steering wheels in cars, any sort of thing like that.
That's right, cleanliness is really important,
yes.
Yeah.
And personal hygiene. People should be very aware. It's amazing how people just sneeze and guffaw around the place. And
exactly.
Yes, I think they'll be getting lots of dirty looks if that happens from here on in. Good luck with your work, Doctor. Thank you very much indeed for talking to us this morning. That's Dr. Gemma Newman, who is a GP in London. Thank you very much indeed.